Hi everyone, this is Dia Shrestha, and my topic is telemedicine. The definition of telemedicine is the use of medical information that is communicated distantly from one place to another through technologies to improve patients' clinical health status by being physically present at either one site or the other. Almost every state in the US has integrated telemedicine in their clinics and healthcare industries. They can easily communicate through internet-based services and get all their electronic health records online. So let us look at how telemedicine first started. Telemedicine has been in use in some form or the other over 30 years. When it was first introduced, it was referred as medical assistance through technology. But projects of telemedicine between 1960s and 1980s failed due to the lack of technologies, practice, and funding issues. The first company to introduce telemedicine was Starplock, which delivered medical care to the Papago Indian Reservation in Arizona. Next, the National Aeronautics and Space Administration quickly followed and used telemedicine in the early 1970s. They were using the telemedicine to communicate from the spacecraft and their aeronautic suits. Also, in the early 1960s, a study was done of telemedicine in a telepsychiatry setting between Nebraska Psychiatric Institute and the Norfolk State Hospital in Nebraska. They used two-way closed-circuit microwave television systems that give successful outcome, showing the major benefits of telemedicine. Today, telemedicine has gained a widespread recognition due to its uses and vast communication skills through technology. Telemedicine today is defined as the communications of patient health records through technologies between Telemedicine can be classified into five types of services: specialist referral services, patient consultations, remote patient monitoring. We will now go over the five main types of medicine services. The first one is the specialist referral services. This service involves physicians and medical specialists assisting a family practitioner with a diagnosis. The patient can see a specialist over a live or the transmission of diagnostic images or video over the internet. Radiology is the most common use of telemedicine as thousands of images are read each year via the internet. Other areas include cardiology, mental health, pathology, and neurology. The second type of services through telemedicine would be patient consultations. These services include telemedicine to provide patient health records like audio, still, or live images between the patient and the physician for use in diagnosing a patient for the day-to-day care. The third type of telemedicine services would be remote patient monitoring. In this service, EKGs, heart, lung, and breathing monitoring systems provides live updated reports to the doctors and healthcare providers at rural areas to improve patient healthcare. The fourth telemedicine services is the medical education, where services includes doctors and medical students who take live feed via the internet without the hassle of traveling from one place to another. And finally, the last service is consumer medical and health information. These services are specially for consumers and patients who want to participate on online discussion groups, forums, and websites about healthcare information and updates through the internet. Next, we can look at the delivery mechanisms for telemedicine. First is the networked programs. This network may use dedicated high-speed lines or the internet for telecommunication links between sites within a tertiary link in hospitals, clinics, or rural areas. Number two, point-to-point connections. This connection can use private high-speed networks by hospitals and clinics that deliver services directly or outsource specialty services to independent healthcare providers. Third is monitoring center links. This type of link is used by physicians, especially for patients at home. They use landline connections to communicate directly, like, for example, cardiac, pulmonary, and fetal monitoring, home care, and related services. And lastly, we have the web-based e-health services, which is the direct patient care site where the patient and the physician each can reach each other via the internet services and communicate directly with one another. Now that you know the five main types of telemedicine services and the mechanisms by which they are delivered, we can now look at the roles of telemedicine. The first role is enhancing decision making and providing access to health records. Secondly, would be supporting and facilitating smooth communications between the healthcare providers and the patients. Thirdly, promoting health and changing behaviors to adopt and maintain good health. And lastly, educating physicians, patients, and care workers relating to health problems and training them to get accustomed to monitoring the telemedicine. Telemedicine is now used as a tool of communication between a doctor and a patient. It is most beneficial for people living in isolated and remote regions where they can reach and get healthcare directly through technology without being physically present. It also allows the capacity of healthcare providers, doctors, and physicians to service millions of patients in all one setting through the internet. This This increases the efficiency of physicians' office workflow through the management of professional healthcare staffs, shorter hospital stays of patients, and cutbacks of travel times. Now that we have looked at the benefits of telemedicine, we can see how far telemedicine can go. Telemedicine is becoming more popular as patients today are receiving care from all across the world. Telemedicine has slowly decreased the hospital admissions of patients by 83% and shorter stays in the hospitals, which means reduced costs for the patients. Home nursing visits have also decreased by 66%, and which lowers the overall cost of a patient by at least 30%. No बोल रहे